Welcome to Bethany Thrasher's Community Teaching Project, conducted in Punta Gorda, Belize, as a part of my requirements to meet the California Board of Registered Nursing Public Health Nursing Certification. The other audio tab on this slide is the theme for the national anthem of Belize. Enjoy. I'd like to begin with introducing you to the non-governmental organization that I worked with in Belize. The Hillside Health Care International is a nonprofit, non-governmental organization that's been providing free health care along with education to and with healthcare providers from around the world. Let me share with you a little bit about why it made perfect sense for me to develop a teaching project in the country of Belize. I've worked abroad, and in this particular location, we deliver a number of health education topics regularly. In fact, we have over 10 topics for the 12 travelers in my group to deliver. We are using resources from within the country along with evidence-based practice from North America's healthcare system. And since I've worked with this population before, it will make the assessment and focus of my presentation relatively smooth and flawless. I've provided these two maps to give you a better understanding of the location and size of the country of Belize. This photo is for reference only. Another important thing to point out with my community teaching project is looking at a compare and contrast between really the country of Belize, which is a total, well, a little bit, almost 9,000 square miles. And you can see that with a population at the time of about 300,000, there were approximately 34 people per square mile in the entire country. Now, shift gears, come back to California, Southern California, in Anaheim, where Disneyland is located. You will see that Anaheim has a population of 350,000 approximately, and it is over an area of only 50 square miles. That means, in contrast, that there are nearly 7,000 people per square mile living in Anaheim, California. There's some additional details in the speaker notes for you to review if you're interested in looking at the region of Toledo where I was working. The population was 30,000, 16 people per square mile. The stars on the map to the right indicate the villages that Hillside Healthcare International serves with their mobile clinics. They provide the mobile clinic service to locations marked with the stars, and they visit once or twice a month. Some locations are so far or deep in the jungle that it's necessary to cross rivers and bush with machetes for more than 5 miles each way on foot. So the public health director, Mr. Matthew Nicasio, explained many things to me about getting into those remote locations, which I personally have never had the privilege of visiting. I've only gone to clinics that we could arrive to by automobile and short walks. This picture shows a team loading up after holding a successful mobile clinic. I love sharing this slide. Health fairs are a part of the new normal health culture in Punta Gorda, Belize. And they hold a monthly health fair in Central Park. It's a small square in the middle of town, with residents coming to have their blood glucose and blood pressure checked, and with referrals being given to have them go to the clinic directly or to the local hospital. These basic vital assessments are taken along with the name and the date of birth of the patient so that they can report those back to the Ministry of Health in Belize. So you can see there's a partnership with the government of Belize along with this non-governmental agency, and they have a beautiful relationship providing these frequent assessments to the community so that they can identify early on hypertension, diabetes, which are both very chronic and very prevalent in this region. So they are able to document the services that are rendered and continue to receive the government support. So on my project, I was working to share basic eye health education with this military veteran. He was happy to accept the sunglasses that we offered to protect his eyes, and went along his merry way with his big bundle of fish. Having traveled and worked in Belize with Hillside Healthcare International previously, it was easy to conduct an assessment of the community with my partners on the ground. The Ministry of Health in Belize reported that for the period from September 17th to October 29th, 2017, the number of cases of conjunctivitis, pink eye, was 544. Doesn't sound like a lot, but in terms of Punta Gorda town, that was nearly 10% of the local population. With the Toledo district reporting 1,465 cases, in a population of 37,000, it was clear that the education on conjunctivitis identification, treatment, and prevention was definitely an area for priority. Another factor in selecting conjunctivitis for this project is that the Ministry of Health was trying to get the message out with a comprehensive brochure, but there was no one to follow up with the public when they had questions about that brochure. I confirmed this information further with the local newspaper. There was a lot of questions, a lot of myths, and we were helping with our project to curb some of the cases with our education. Very exciting times. The initial community health teaching for both eye health, common eye diseases, and conjunctivitis was to take place at an employee health fair at the local Belcampo resort. Unfortunately, with a very low turnout at this health fair, we never had more than a couple people at a time in the education sessions. Still, we delivered the education on all topic areas, but the activity that required a minimum of 8 people that I had prepared was not able to be integrated. We elected to try again on a mobile health clinic day, and we had the same situation, only 1 to 2 people at a time. It was finally at a school on our last day in the clinical rotation that we were able to deliver the general eye health education to all classrooms at the elementary school in San Marcos, Belize. We had 3 groups, 26, 16, and 31 in the groups, and the education went very well. We gave away sunglasses to all the children and their teachers, as well as soap to support the simple hand hygiene component to our teaching project. And I was still not able to run the pink eye infection activity, but we felt that our overall education efforts were exceedingly positive. The picture on the right is the San Marcos elementary school that we visited, and on the left you can see one of my traveling companions and registered nurse, Carlos. He did part of the education, and some of the kids enjoying their sunglasses. So, working with a team, the 3 nurses on this project, we had such a great opportunity to develop some interactive projects. Of course, we had to be mindful because of infection control with all of the conjunctivitis in the region, and but we moved between the different age groups with our education and adapted the education along the way per the audience and their developmental level and their learning styles. We had the interactive portion, as I mentioned, and that included glasses that mocked glaucoma and cataracts, and we invited the participants to try on the glasses and guess which of the disease processes were being imitated by the glasses. Now, this was so much fun. About 90% of the time, the participant was able to accurately identify the disease impacting the vision, and we were able to carefully and meticulously clean the glasses in between the participants. The brochure on the right is from the Ministry of Health in Belize, and it was used as a basic guide to build an interactive eye health education set for this program purpose. It's important to bring education to the community that's easily understood and, if possible, in a familiar language with visuals and including return demonstration on new skills as considered beneficial. The background on why many healthcare providers in Belize believed this infection was spreading so rapidly was due to the requirements of the government that anyone out of work for more than 1 day due to illness must report to the Social Security office. This issue was immediately responded to, and the government issued a following directive that if you had pink eye, that you could stay home until you were free of symptoms and then report to the Social Security office. In our education, we provided a summary of the symptoms of the problem that can include the red or pink eye, the color change of the white of the eyeball, and the itchiness that follows. A discharge in the affected eye. Typically, it forms a crust when you sleep, preventing your eye from becoming open easily, and it could be more pronounced upon waking in the morning. We explained that they may feel a gritty sensation as if they had sand in their eye, and maybe even a sensitivity to light or blurred vision in that affected eye. So these were the basics that we shared with the community in a lay language. The poster on the left-hand side was created by all three team members, with the main goal to focus on best practices for eye health. The poster on the right was pinpointing conjunctivitis education due to the recent outbreak. In that local area, the need to stop the rapid spread was critical. Using visual cues to pass on education is very important while working with participants that have low health literacy and/or low level of education. Providing visuals that are appealing and flow in pockets of information that a viewer can easily follow helps to facilitate learning new information. Preparing for learners of all ages is what prompted the significant focus on hands-on activities like the glaucoma glasses, hand hygiene infection demonstrations, and giveaways of sunglasses. Finally, we wanted to give the participants resources not only for eye health, but for the local medical centers. The board has a photograph of the friendly staff and volunteers at Hillside Healthcare International, along with their phone number and the hours that the clinic is open, and what days transportation is provided. Here you can see the full pink eye conjunctivitis education poster. The following slides will cover a review of the areas on the poster a bit closer so the viewer can understand the goals of the poster. The poster was created in California so that it could be laminated and used for long periods of time in Belize. It was necessary to make some corrections on the poster. In the final photograph of myself and a colleague, you will be able to see some of those changes in terms of hours of the clinic service and transportation resources. Bring the viewer into the board with a creative and interesting photograph, colors, or information. The information covered really helps the learner to better understand their eyes. Providing the symptoms can alleviate some of the stress that the public may feel if they're worried about contracting or having become in contact or close contact with someone with conjunctivitis. Just under the education title, the symptoms to watch for if one is concerned about pink eye. In this section of the poster, we address what the Ministry of Health and numerous other agencies recommend with stopping the spread of conjunctivitis infection. First, hand hygiene, followed by staying home from work and avoiding populated areas. This was on the top right-hand side of the poster, and strong visuals really help people to connect with what to do and how to take care of themselves. This section of the poster board really draws the crowd's attention and gives them a visual on what they should be mindful of, as in not sharing makeup and eyeglasses, be careful with contacting other people, shaking hands, crowds. It was a really great way to send a message without using a lot of language, because the developmental and health literacy of the audience was very low. Just quickly, this is a photo of the staff and volunteers at the Hillside Healthcare International Clinic and listing their hours and phone number for the local community to get that information. So an important part of this project was being part of the education itself, and I worked with a team of colleagues. We had a fantastic time, really delivered a lot of wonderful education. The audience had as much fun as we did, and in this particular picture, it's just to demonstrate that I was actually there and part of this health education project. Working on this project and in this area was just such a blast. Um, but looking back and doing some evaluations and reflections on that time, we had to adapt the presentation based on the time that our team had to practice together and other elements. We lived in different states, and we occasionally had our peers present their hand hygiene education before our education so that we could just briefly touch on hand hygiene while focusing the rest of our education on eye health. And in terms of our interactive items with the sunglass giveaway, hand hygiene demonstrations, and other infection control demonstrations, we pulled those in and out of our presentations based on the audience level of interest, the time or capabilities in the area that we were limited to, and then as well as gaining new insights from some of the participants who had shared their knowledge. And that was very beneficial, and it was a very effective method to have others share their experiences in the audience about healthy living and how they've managed their disease processes like glaucoma or other issues related to the use of sunglasses to protect the eye. So don't forget your audience in your educational outreach. They definitely should be a part of what you're doing. Thank you for taking the time to go through this presentation and listen to my little snips, my little audios. I just wanted to share with you this little view of the Honduras Bay from Punta Gorda town, PG town. I took this photo in the very first year that I visited Belize. I think I went in early 2014. I think so, or 2015, one or the other. But anyway, it's a beautiful place. Love to chat with you about it. Please reach out if you have any further questions about this project. Thank you and have a lovely day.